I'm Dr. Tom Groover of Boulder Chiropractic Clinic, formerly located at 2725 Iris Avenue in Boulder, Colorado. On January 31st, 2020, Boulder Chiropractic Clinic was forced to evacuate from its location of 21 years. We're now based in very convenient nearby Louisville, Colorado, within the Koru Chiropractic office of Dr. Norris Goldberg. Our new address is 956 West Cherry Street, Louisville, Colorado. Boulder Chiropractic Clinic was founded in 1999 as an upper cervical chiropractic specialist clinic, providing to our patients the diagnostic and corrective procedures of the National Upper Cervical Chiropractic Association, NUCCA or NUCA. Over the years, our clinic evolved to include sports chiropractic, extremity joint corrective care, neuromuscular acupuncture, and rehabilitation. In the early years of our practice, we became known for our expertise in treating seriously injured patients. We were probably the first clinic to develop effective protocols for diagnosing and treating fibromyalgia. Our clinic's regular schedule ranged from relieving and eliminating conditions like migraine and tension headaches to treating, stabilizing, and healing of pain, weakness, and stiffness of the neck, back, sacroiliac joints, and extremity joints. We even developed advanced procedures for stress and trauma release. We became well known for early detection and clearing of ordinary joint stiffness and weakness. These may not seem to be very painful conditions, but they interfere with competitive and recreational athletic performance. Stiffness and weakness also detract from people's work activities, their activities of daily living, and their general quality of life. Our years and years of successfully helping people with conditions like tinnitus, dizziness, vertigo, and cyclic vomiting have prepared us for our current upsurge in Meniere's disease referrals. Meniere's disease is a complex syndrome including ear fullness, tinnitus, hearing loss, dizziness, vertigo, nausea, and cyclic vomiting. Treating this condition required us to create and implement even more specific, personalized, multidimensional care plans. Essential to these plans is correcting and stabilizing the craniocervical junction disorder at the root of most Meniere's disease, the upper cervical subluxation complex. That is the misalignment of the uppermost neck, which distorts the alignment of the upper cervical spinal joints, disrupts the spine's structural support of the body, and causes abnormal spinal movement. The upper cervical subluxation complex specifically impairs the mechanical, neurological, and muscular control of the head and neck. More importantly, the upper cervical spinal subluxation complex compresses and stretches the brainstem and the upper cervical spinal nerve roots. Our first goal in treating Meniere's is to correct the upper cervical spinal misalignment, to stabilize that correction, and thereby to restore normal brainstem function. Secondly, to greatly reduce or eliminate our patients' combined neurological distress from their global subluxation complex. We define the global subluxation complex to be the combined effect upon our patients' central nervous systems from all the joint subluxations throughout their bodies and resulting impaired neurological control, inflammation, pain, weakness, and stiffness. Our top-down, inside-out approach treats and stabilizes causes, subordinate causes, and complicating factors of Meniere's disease, thereby reducing and stabilizing the Meniere's disease symptoms. Boulder Chiropractic Clinic's 21-year success is based on our attention to the diagnostic and treatment detail required for finding and treating that which causes our patients' conditions. We routinely help people who say they have seen all the experts and we are their last resort. That history at our Iris Avenue facility is now over. Water destroyed our clinic in May of 2019. It flooded our office from 3 sides and from the ceiling, damaging our walls, ceiling, floor, front desk, and furnishings. The landlord had permanently sealed the gutters out in the front of our office so the water wouldn't flow down the downspout and onto the sidewalk area entrance and cause a safety hazard. But unfortunately, the gutters overflowed, and that overflow is a big problem because you'll see here that when the water cascades over the gutter, it flows between the building and the gutter, and then it travels. And it travels into the ceiling of the front sidewalk overhang. And here's some swollen water in the outer part of the overhang. And then it migrates into the office, and you can see the damage here, but what you don't see is the black mold that's forming in the wall. Then there's the leakage that occurred in the ceiling from broken pipes, and you see the stains on the ceiling tiles here resulting from that leakage. And this is where the tile was pulled away. You can see the water stains up there. Then black mold appeared on the outside of our meditation room wall. We first noticed that we had a problem with flooding coming from the Northside restaurant when we saw the paint pulling away from the baseboard at the exercise area in our office here. And it had pulled away quite far away from the wall. And in addition to that, we noticed this white smudge. That white smudge is another kind of mold. And then we went into the adjacent exercise room and pulled up the foam, and you can see the wetness on the foam and the mold on the wall next to the foam there. And so we began following the black mold appearance there and saw that there was quite a bit of water, fresh water, that had just, entered the room there and flowed beneath the mattresses in the meditation room. And then we noticed that our desk was showing damage, and so it had flowed across the floor between the tile and the cork there. And you'll see here that there's some the paneling is pulling away from the frame and from the molding. And then over here you see the cracking and the discoloration that has occurred there at the bottom of the desk. A few of our patients have suffered from chronic inflammatory response syndrome, CIRS or SIRS, caused by black mold exposure and the mycotoxin poisoning from that exposure. Patients suffering from this complicated multi-system disease become extremely hypersensitive to all sorts of environmental contaminants, even to tiny fragments of black mold spores. Such exposures will trigger them into a cascade of SIRS symptoms. Some common symptoms of SIRS include cognitive difficulties such as brain fog and trouble concentrating, fatigue and weakness, chronic fatigue syndrome, unexplained weight gain, frequent urination, excessive thirst and dehydration, fibromyalgia and visual insensitivity, postnasal drip and sore throat, numbness and tingling, digestive issues and mood swings, tinnitus and static shocks, vertigo and metallic taste in the mouth. The north side flooding of our clinic came from an adjacent restaurant boiler. So the restaurant's owner sent us his contractor to assess and repair the floodwater damage to our walls, floor, and front desk. The contractor cut a small window in the wallboard adjacent the boiler room. There he found black mold and began removing the wallboard on both sides of the opening, following the mold to see how far it had gone. After opening 2 walls and seeing the extent of the black mold infestation, the contractor told us to seek expert help. He told us the story of his relative's premature death from brain cancer. That cancer was caused by the man's long-term exposure to black mold above his ceiling. Then we had an expert black mold inspector visually inspect our premises, measure the moisture within its walls and floor, and take air samples. His report affirmed that our clinic was black mold infected. That pre-inspection gave us the baseline measurements for the severity of our black mold infestation. Then our facility was black mold mitigated by an expert mitigator certified in medical facility black mold mitigation. I'm standing out in front of my office. We're recovering from quite a bit of water damage and mold infection. The office has been mitigated. We've had a pre-inspection for mold, a mitigation, and have passed our post-inspection. And now we're getting ready to undergo some reconstruction. So this is the where you see these chairs. They're not usually here. This is the exercise therapy part of the office. The wall was removed like 4 feet. And so there are still studs there. Everything was cleaned. You can see that there's a intersecting wall that was removed at 4 feet in one of my treatment rooms. And as we proceed, you can see into the treatment room here that there were walls that were removed. There was a wall removed in the back, on this back side of the room here. And right here you can see the mirrors. There's a mirror right there that remains in this office that has the gold frame around it. But down below here is a separate mirror, and that's our front door to the office. There's another mirror right here. Well, those mirrors were positioned on the wall. You can see the brackets up here. Those were mounted here and had to be removed for the mitigation. So now, as we look across, you can see this entire wall has been removed from floor to ceiling. And that was full of mold. And then down here at the bottom, all that's been removed. So there was water damage to all of these structures, so required removal in order to be repaired. But as an added a 2-for-1, we got black mold contamination everywhere. Now, what you can see here is down on the floor here, we have ceramic tile, and then there's a big hole opening. That opening is where our front desk used to be. So we had a nice walnut desk there, solid walnut, and it got wet and cracked in many places. It started looking pretty bad, but then it was also infested with large amounts of mold underneath and inside, so it had to be taken out. You see that there's a floor issue here, so we want people to watch their step. Now, as we proceed, you can see the cork floor that's continuous with the concrete that was originally went all the way up to this tile, and that's opened up because that was contaminated and injured also from the flood. So what needs to be accomplished is this tile here needs to be continued out, just to go ahead and fill in this this hallway area. There's our boiler room, and fill out the hallway area here, which is a little bit of area that needs to be retiled. Needs to be tiled back here so that everything matches. Otherwise it's going to look pretty bad. So now that's pretty much the damage. Now there is a complication, and that is right behind this wall right here is a boiler, and that boiler is right against the wall, and it's going to mean that there's going to be quite a bit of additional work beyond the ordinary wallboard replacement. and we haven't found anyone who has a real clear idea. We have a person who's going to come in and do the reconstruction. He's very competent, but has never encountered anything like this before. So we need to figure out a way to get wallboard between the boiler and its plumbing in a very cramped quarters and have it sealed. And we're trying for a waterproof wallboard with some type of sealant along the bottom to prevent this problem from happening again. So that's pretty much it. You've got this office with 2 walls that need to be reconstructed, 1 wall that's extremely complicated. We have another wall here in the exercise room, and then in the reception area under the window and below the magazine rack there, and all along this wall. And of course then you've got this floor situation that needs to get resolved all through this area right here. So that's the extent of the damage, and we'll be giving you more information as we get more coming in. Thank you. The mitigation team installed an airtight barrier separating the rear third of our clinic from the black mold area. The mitigation area was pressurized with outflow through our front door mail slot. We were told not to enter the infected area. The mitigators wore respirators and other protective gear while removing infected materials and treating the remaining surfaces. Since we weren't able to enter that work area, we couldn't take photos or movies of the large quantities of mold that were uncovered during the mitigation. About half of the black mold infected wallboard and infected insulation were removed. All infected flooring and our large custom built-in walnut front desk was demolished and taken to the landfill. The remaining wallboard and other surfaces were cleaned, disinfected, and sealed. Our clinic's south side wall was black mold infected floor to ceiling. Pipes above that adjacent restaurant's ceiling leaked into the wall, and one of its sinks leaked into the wall, floor, and under our front desk. Fully removing that infected wall material would have required the Southside restaurant to shut down for mitigation and reconstruction. The building's owner was unwilling to close that kitchen. Contrary to the mitigators' recommended best practices, rather than removing all infected materials, the mitigator could only surface treat and seal that wall. Following mitigation, the black mold inspector re-inspected our clinic. His report stated that a brand new water leak had just occurred post-mitigation. The north side restaurant boiler had leaked again, and that water had collected on the exposed framing of the newly mitigated wall. Otherwise, his moisture readings were normal. Black mold levels had significantly reduced but remained higher than reported background levels. Immediately following the black mold inspection, one of our Sears patients was injured and required immediate treatment. She was willing to risk exposure to the black mold in exchange for immediate treatment of her injuries. After we reevaluated her and treated her injuries, she reported having a Sears episode and told us the black mold mitigation was not good enough. Then, within the same week, water from the upstairs pipes cascaded again through our ceiling into the heart of our clinic. This is a video of the new leaking that came into the office starting yesterday, and it's happening again. It starts inside on the ceiling up here. You can see the water on the threshold, and it flowed down, and now it's migrated over across the ceiling. It's coming down from the middle of the office here, the middle of the hallway, and landing down on the floor here and puddling on the floor. At about the same time, the front side gutters again backed up with storm water. That overflow poured into the building's front walkway ceiling. it flowed across that ceiling into our clinic and stained our ceiling tiles. Previously, we had found our own contractor to do the post-mitigation reconstruction. He had reported to us and to the landlord that immediate structural redesigns and repairs to the building were needed, or more flooding was imminent. He insisted changes be made to the adjacent boiler room, our office walls, the pipes above the ceiling, the building's gutters and downspout, and the Southside restaurant's hot water heater. Otherwise, he said the testing, mitigation, and reconstruction were futile. He reported that the building was unsuitable for housing our clinic and said we should vacate the premises. The landlord rejected our contractor recommendations and hired a cheaper contractor to make the cosmetic repairs needed to return the building to its original state of dysfunction. Our reasons for remaining in the building through all this trauma was our unique, expensive, state-licensed X-ray suite with its 100 amp electrical service upgrade, leaded walls and window with its metal door, dark room X-ray viewing and analysis station, and X-ray storage, and above all, our precisely aligned, tricked out, NUCA certified, high-frequency X-ray equipment. At our advanced age, moving to another building and recreating this X-ray facility is financially unfeasible. Also, our previous searches for a more suitable location were unsuccessful. So after 21 years of practice success, then having endured 8 months of black mold exposure, disruption of our patient care, the hardships of finding and scheduling all the contractors and inspectors, having to undergo the inspections, the inconvenience and disappointments of the compromised mitigation, reconstruction, and the continued flooding of our clinic, our Sears patient's black mold reaction, and the landlord's refusal to prevent future flooding, we were forced to make one of the most difficult changes of our lives. On January 31st, 2020, we closed Boulder Chiropractic Clinic at Iris Avenue location and evacuated the building. Thanks to Fort Collins NUCA specialist Dr. Peter Bulcher of Turning Point Chiropractic for hosting us during the first month following our clinic closure. Thanks to Dr. Ty Carzoli of Denver Upper Cervical Chiropractic for referring us to his good friend, NUCA specialist Dr. Norris Goldberg of Koru Chiropractic. Dr. Goldberg's X-ray suite is perfectly adapted for performance and analysis of the specialized NUCA X-ray studies. Dr. Goldberg and I performed the precise NUCA X-ray machine alignment. We took the NUCA X-ray alignment images, submitted them to NUCA. NUCA approved them, and the equipment is now NUCA certified. I've designed and built custom lead X-ray attenuating NUCA X-ray filters, which we are now testing. We invite you to visit us in our new location. If you are new to Boulder Chiropractic Clinic, we recommend to you our free personal in-person introductory consultation or to our online virtual introductory consultation. Call us at 303-442-7772, or you may schedule your consultation online by going to our website, boulderchiropracticclinic.com, and clicking on Schedule. If you are already one of our patients, schedule a current follow-up appointment for checking of your joints, nerves, and muscles, and for follow-up treatment, as might be indicated. Just call us or go to our website and schedule your follow-up visit. Thank you to our patients and friends for your continued loyalty to Boulder Chiropractic Clinic during these extraordinary times of hardship and change.